Let's go to the next slide. Basically, our disclaimer is that our policy is subject to change. This information is current as of August of 25, so this is updated in real time. The most current information can be found on our public website. So you can find our current information, and then if we have any updates, it'll be updated in a timely manner, and you can find that on our website. Okay, next slide. Uh, so, so pre-admission screening and resident review, that's what the acronym PASSR stands for. We're going to talk about the pre-admission aspect, which is something that affects most of you as providers, but also the resident review, and they are kind of two of the same function. We're going to talk about the differences between that. The purpose of a PASSR is to assure that residents living in nursing facilities with mental illness and intellectual disability or related condition are in the appropriate level of care and receiving the services to meet their needs. What I want to say about that is years and years ago, people with disabilities were often kind of warehoused, if you will, in nursing homes or maybe psych facilities, state hospitals, things like that. The purpose of PASSR really, what it means is that we want to make sure that people are at, and here's the operative term, that they are at the least restrictive level of care, and that we're not just placing them places, is to assure that they are at the least restrictive level of care, and also that they're receiving the appropriate services to meet their needs. And we'll get into the specifics of that pretty soon. Okay, next slide. All right. So the PASSR process. So before we begin anything, it's kind of a process that we're asking questions. So we're asking ourselves, does the client have or is suspected to have a major mental illness, an intellectual disability, or a related condition? Do they need nursing home level of care? And do they require specialized services? So let's go over those bullets just briefly. When we say has or suspected to have, what we want you to know is that you don't have to be certain that somebody has these diagnoses. We order PASSRs all the time on the suspicion of that because we don't want to miss anybody. So we don't want you to feel uncomfortable reaching out to myself or Nathan or Steve, the three analysts in behavioral health. We want you to reach out to us for a consultation or a screening, as we call it, or go ahead and fill out, which we'll discuss later, that level 2 PASSR form and submit it. And if we do an evaluation on somebody that it's been stated, or even in paperwork actually, that they have, let's say, for example, an intellectual disability, the results may come back from the evaluator, like Dr. Teat, that this person doesn't actually have an intellectual disability, but we don't frown upon you submitting that level 2 or calling one of the analysts for a consult, because again, we don't want to miss these people. We'd rather err on the side of caution in that sense. Bullet number 2, where it says, do they need nursing facility level of care? So let's remember that it's not just that we're looking at these three areas, the intellectual disability, mental illness, or related condition. Remember that they must also physically have a need to be in a nursing home. So, for example, if you have somebody who has a diagnosis of schizophrenia, but their only medical concern is that they have mild hypertension that's controlled very well with medication, that person, again, if that's the only medical, they would not qualify for 24/7 nursing care. That's the criterion, 24/7 nursing care. Um, So remember that. Now, and there are cases where you send in a passer on somebody and it's determined by the evaluator that they do not require nursing facility level of care at this time. Remember that that is something that can be revisited over time. So let's say that Nathan or Steve and I have done a screening 2 or 3 years ago for somebody who did not meet the qualifications for 24/7 nursing care. But in that time, over the time of 3 years that's passed, or even 1 year, I mean, these things can come up suddenly. Um, or anytime, if somebody then develops insulin dependent diabetes, or they're now incontinent, and let's say a res care can no longer meet their needs, or an ICF IID facility can no longer meet their needs, they're a fall risk now, things like that, then we will revisit that. So it's not a one-time shot at this. At the time, do they meet the nursing facility criterion or not? So we want you to remember that. And do they require specialized services? Do they need adaptive functioning, things like that? Do they need a wheelchair? If they have a mental illness, do they need to have counseling, outpatient services such as that? I know many of you have Millennium come in and things like that. So that would be like a specialized service. So that's kind of the PASSR process, is we ask ourselves these questions first before we do anything. Next slide. All right, we're going to talk about the level 1 screening before we get into the level 2 screening. So the level 1 screening is also referred to as the LTC 300R form. It must be submitted electronically. So we don't do snail mail anymore. It's everybody needs to submit these electronically for all nursing facility applicants for the screening process. And bullet number 2 is where you can see our policy about that. Forms must be completed on all nursing facility applicants, regardless of payer source, meaning regardless of whether they are private pay or Medicaid, whether they are a skilled patient coming only for skilled needs, or whether they're long-term care. So what I tell people is this means pretty much everybody that comes through your door must have a level 1 screening. Next slide. So remember that to be eligible for nursing facility services, the individual must require a treatment plan involving the planning and administration of services, which requires skills of licensed technical or professional personnel that are provided directly or under the supervision of personnel and are prescribed by the physician. They must have a physical impairment or combination of physical and mental impairments, like we discussed on the previous slide. They must require professional nursing supervision, which would include medication, hygiene, dietary assistance. So again, basically, they must require this 24/7 nursing care. Next slide. Um, Also, other criterion is that they lack the ability to care for self or communication needs to others. So if that would be an example of difficulty with ADLs, not able to care for themselves anymore, communication issues, maybe post CVA, or maybe on the related conditions or intellectual disability if they do not, or if they're nonverbal. So those would be some examples of that. They must require medical care and treatment in a nursing facility to minimize physical health regression and deterioration. A physician's order and results from a standardized assessment which evaluates type and degree of disability and need for treatment must support the individual's need for nursing home level of care. Only standardized assessments approved by OHCA and administered in accordance with Medicaid-approved procedures shall be used to make the nursing home level of care determination. Next slide. All right. The LTC 300R form or level one screening form must be received by OHCA within 10 days of admission. Per our policy, which that's outlined on bullet number 2, sooner care payment may not be made for a resident whose LTC 300R requirements have not been satisfied in a timely manner. Jeannie, did you want to say anything about bullet number 2?
Just that we are getting clarification from OHS on that as OHCA does not um, administer the penalties for level one timeliness issues. So if there are questions about that later, certainly we can reach out to you and provide OHS's guidance on that.
Thank you. On to the third bullet. The form must be completed electronically. So again, we're not faxing or emailing unless arrangements have been made prior via our secure portal, provider portal. For questions regarding submitting or correcting the LTC 300R, please refer to the PASSR Level 1 training PowerPoint located where the providers can go on the provider portal. And also, if you have made a mistake on a LTC 300, feel free to reach out to myself, Nathan, or Steve, and we can also walk you through the appropriate way to correct that level one. It could be a date of admission that's wrong. It could be a wrong date of birth or social security number, anything like that. Please feel free. It could also be, and we'll get to this in a minute, if some of the 6 questions in that bottom section of the LTC 300, if any of those are answered incorrectly, sometimes people get in a hurry and instead of answering, their intent is to answer all no on those 6 questions and they accidentally hit all yes. We've had that come up often. Just give us a call and we'll be happy to walk you through how to change it, how to submit it, and what you need to do to correct it. So that's an easy process to fix. If you make a mistake, don't worry about it. Okay, next slide. So you guys are all familiar, I'm sure, with this. This is, albeit a fuzzy copy, but this is a copy of the level 1 PASSR. This is what it looks like. And at the bottom, and we're going to go over these in more detail, at the bottom are those 6 questions that are so important to the PASSR process. So we're going to start going over that in the next slide. Okay, let's go. There we go. Okay, so this is real important. We're going to spend just a little bit of time on this. So this is your screening form at the bottom of the LTC 300, which indicates, does this person need a level 2 PASSR or not? Let me take time right here on this slide to say this. There's confusion, and it makes sense to me about, especially for people that are new in their role, there's sometimes some confusion. We think the number 1 comes before the number 2, and that logically the level 1 might get done first, and then you do the level 2. That's actually not correct. This screening, while you cannot submit a level 1 until they admit to the nursing home, but these 6 questions should be a guide for you to have answered prior. That's the key word, prior to admission. And I tell folks to help them. I know a lot of my providers have done something I think is really smart. They go to the copier and they blow up these 6 questions and just have a copy of that, next to their computer on the wall, next to, their intake process and things like that. And it really is wonderful as a reminder that these are the 6 questions I want to ask myself prior to admission so that we don't admit somebody and then later discover that we should have been more thorough on these 6 questions. So that's just, an idea that a lot of my providers have done. It seems to help them a lot. So you may want to look into that. So let's go over these. The questions 1, 2, and 3 pertain to a major mental illness. Questions 4, 5, and 6 pertain to an intellectual disability or related condition. So let's go through them. Question number 1, does the individual have any evidence of serious mental illness, including possible disturbances in orientation or mood? And remember that dementia or major neurocognitive disorder or Alzheimer's is not a mental illness. That's neurological. So if somebody has dementia, you would not screen them on level 1 as yes. Now, somebody might have both dementia or Alzheimer's or major neurocognitive disorder and a major mental illness, such as bipolar, major depression. In that case, you would mark question number 1 yes if they still have both. Um, Question number 2, do they have any diagnosis of a serious mental illness? So, we're looking at, for example, we're looking for bipolar, schizophrenia, psychotic disorders, um, major depressive disorder. Let me say this right now about major depressive disorder. Um, we kind of call bipolar, schizophrenia, um, kind of a slam dunk, if you will, as the need for having a level 2 PASSR conducted. Major depression is something that, as we all know, is on a spectrum. Somebody can have major depression single episode. They could have major depression mild, moderate, recurrent, severe, with or without psychotic features. So we don't always order on major depression, but certainly if they have a diagnosis of major depression, you'll mark number 3 yes. The same thing goes for psychosis. Psychosis can be as a function of a diagnosis of a cognitive disorder like Alzheimer's or things like that. But it might be that they have a major mental illness. So again, if in doubt, mark yes, and that's something that we'll go over. Question number 4, does the individual have a diagnosis of an intellectual disability or a related condition? And we're going to go into the definitions of those in just a little bit. Do they have a history of an intellectual disability or related condition? And do they have any evidence? So that would be IQ testing, documentation, something like that, of an intellectual disability or related condition. Okay, next slide. So remember, prior, not after, but prior to admission, an answer of yes to any of these 6 questions, and it's section E, that's that bottom part of the LTC 300R, regarding mental illness, intellectual disability, or related condition requires a screening for a level 2 PASSR to be faxed to an analyst, which would be myself, Nathan, or Steve at this number, the 708-7181. And I'll say this, that to include not only screening in that PASSR form, but also if you want to do what we call again a screening or a case search, something like that. You know, Stephen, Nathan, and I, that's our job. Some people kind of hesitate to call us. We don't want you to hesitate at all. It's better to be proactive and screen for these things than admit somebody who has one of these diagnoses and miss that, or perhaps put yourself in a place where there's a recoupment issue at hand. So again, we're happy not only to look at these screenings prior to admission, we're happy to take calls. And it's amazing how many times people will call and say, let me give you this person's name and social security number. Can you run them and see if they're in your system? Because I don't have anything on them, but I just want to double check. And it's really amazing how many times when I will run that screening and just look at the name, social, something will pop up that the provider has been totally unaware of. They don't have it in their paperwork. They don't have it as something that the family has stated about this individual or prospective resident. And I might find that they have had, in fact, multiple PASRs, and that some of these PASRs are no longer current. They have lapsed. So calling us to do a quick screening, we really welcome that. We hope that you feel free to call us and do screening because, again, that is so important to the PASSR process and catching these things before they're in your facility. Okay, next slide. Okay, so who fills out the forms, whether it's a level one LTC 300 form or that level two form to screen for these mental illnesses or intellectual disability or related conditions. So it can be the administrator, although often it's not. Usually, the people that we see filling out these forms are nurses, RNs or LPNs, social service director, a social worker, admissions, MDS coordinator. It's whoever the administrator decides in their facility that will be trained to do this and authorized to submit them. It's the responsibility of the nursing home to ensure that a level two is completed on a member that meets the criteria we talked about earlier on those 6 questions. So it is the nursing home's responsibility. Many of the providers will be admitting somebody from a hospital. Remember that ultimately it lies on the nursing home to make sure these things are in order, not a hospice agency, not a hospital, not even another nursing home. It would be your responsibility to make sure that this is completed on a member that meets the criteria. Okay, next slide. All right. So the level two PASSR evaluation screening, it's typable. It should not be handwritten. So we want them to all be typed. We want you to complete every field on the form. The member ID is the member's Medicaid or Sooner Care number. That's if they have Medicaid. If they're private pay, you wouldn't have that number. Also, some people don't have that Medicaid number, and if you don't have it, that's okay. That shouldn't prevent you from filling out the form and completing it anyway and sending it in. The provider ID would be the nursing home's provider number contracted with OHCA. It's assigned. So every nursing home. And by the way, if you have a sister facility, even that sister facility will have a different provider number than the other. Each different home has their own provider number. Okay, next screen. Here's a picture that you all are familiar with. I want to say something. We still have providers that are submitting forms we've updated this form years ago, and we still see submissions on older forms. So let me give you a hint. If the form that you're filling out does not have these two things, you're using an outdated form, and please contact us so we can tell you how to get the current form. If it does not have a field for an email address, and if that number on the top where it says screening for level one or for PASSR level two, where it has the fax number in bold, if it does not have a fax number in bold, then you are using an outdated form and will need to obtain the new form. Next screen. And I believe, yes. So this is the new form. This is how to get the level two PASSR form. It looks like there's lots of steps there. You know, it's really it's very easy. If you have any problems finding some of these different fields when you click on them, just give me or Nathan or Steve a call and we can walk you step by step in real time as you're on your computer. We can walk you through this. But it is a very, I'm not very techy myself, and I find that it's really smooth sailing. It's a really easy form. Um, Remember that screenings will be worked in the order received and that you will get a call. So Nathan, Steve, and I are assigned in our queue these pass our referrals. We receive them either the day of or the day after or so that they're submitted. So know that they're not submitted straight to us, that they are sent to a behavior analyst screener and then they're assigned to us. So so it may go to Nathan, it could go to Steve or myself, and one of the three of us will call you back when we receive your referral and they are again worked in the order in which they're received. And so remember again that, and we'll talk about 30-day exemptions, but remember again that 30-day exemptions and other matters of business can go to our private fax numbers or emails, but PASSR level twos are not sent directly to the analyst. They're sent only to this 405 708 7181 number. All right, next slide. Okay, so there's the policy reference for the full details of level two screening and evaluations. For evaluations for people who have mental illness, the evaluations are conducted by OU College of Nursing. So the Healthcare Authority contracts with the OU College of Nursing for PASSRs related to people having a mental illness. We'll get to who we contract with for the other PASSRs in just a little bit. So we will ask the nursing home to submit the medical records to OU College of Nursing by either fax or email. And on the subject line, you want to put PASSR medical records. On this last line with the asterisk, please do not send medical records to OU College of Nursing prior to completion of the screening. And let me tell you why. Because it's confusing. If you send the records, so Nathan and Steve and I will remind you to send the records to OU College of Nursing. If you send them prior to us ordering that PASSR, it's confusing for OU College of Nursing because they don't yet have our referral in the system and they don't know why they have these records or who they pertain to or what it pertains to. So please don't, we appreciate you being on top of things, but wait for Nathan or Steve Wright to tell you to fax them in to OU College of Nursing. Don't fax them first. Okay, next screen. Okay, so for people who have an intellectual disability or related condition, we contract with Oklahoma OHS, or what we used to call OAOK DHS. Um, so dual pass Rs, if somebody has both a major mental illness and an intellectual disability or related condition, we call that a dual pass R because they are duly diagnosed. And in that case, they would have not one evaluator, but two. So both OU College of Nursing and OHS would be conducting evaluations on that individual. Please note that these evaluations may be completed in person or video conferencing. So we've been approved to do that. Those are legitimate evaluations, even on like a Zoom or whatever the provider and the evaluator agree upon. So those are also legitimate measures for conducting the level two PASSR. Okay, next screen. All right. So we're going to talk a little bit about specialized services for clients who have a mental illness. Um, that could mean a specialized service could be if somebody is decompensating, and let's say that somebody needs to go inpatient psych from the nursing home and admit to inpatient psych to get meds straightened out or to get stabilized. That would be an example. Specialized services such as counseling. I mentioned earlier groups like Millennium coming in to do some counseling on a regular basis. That would be an example of a specialized service for somebody with mental illness. Next screen. All right. So specialized services for clients with an intellectual disability or related condition are those services that emphasize a collaborative effort between DDS and nursing facilities to provide an individual treatment plan designed to enhance an individual's independence, quality of life, and or decrease regression. Specialized services are personalized, individual oriented, and person centered, and may include but are not limited to therapies such as occupational, physical, and vocational services. Okay, next slide. Provisional admissions. So all provisional admissions require prior approval from an analyst, myself, Nathan, or Steve, if a mental illness, intellectual disability, or related condition is present or suspected. Um, Emergency PASRs. So only APS can initiate an emergency PASR. A hospital doctor cannot uh, do that. A PCP cannot initiate that. I cannot initiate that. And providers cannot initiate that. Only APS. Respite. For a respite stay, that also requires prior approval if somebody has a major mental illness, intellectual disability, or related condition. If they do not, you do not need to get permission for a respite stay in your facility from an analyst, but you do if they have one of those three diagnoses. The time allowance is up to 30 days per calendar years. It says here usually 15 days at a time. I'm finding a lot of 7 days at a time, 9 days at a time, and we track that for a respite stay so that we can know how many days they've used up. Delirium, call when it clears. Next slide. Delirium, we're going to define that. So it's any person with a mental illness, intellectual disability, or related condition that is not a danger to self or others. They may be admitted if the individual is experiencing a condition that precludes screening, such as a coma, anesthesia, medication, unfamiliar environment, electrolyte imbalance. This could be, especially in the very elderly, sometimes post-op, if they're struggling with the effects again of anesthesia, even disoriented because of being in a hospital, things like that. So that's kind of the definition of delirium. Okay, next slide. This is just an example. I like to post this for you to sometimes help an APS a worker if they're new or not quite sure what to do. This is what is required for an APS emergency request letter. So it must be on their DHS letterhead, unless they're out in the field, and this is such an emergency that that they're out in the field and just are doing this by phone, by text, or email by phone. So it would be who, the name of the client, their social security number, DHS number, if applicable. What? What are they doing? They're requesting a 7-day emergency, and that needs to be stated in the body of the document. When? So when will when are they wanting this emergency request to begin? and why. Is this person being abused? Are they in an unsafe or filthy environment? Have they recently been evicted? We get a lot of those. Somebody's been evicted and they're non-ambulatory or they can't do their ADLs and they must be admitted immediately. And also a no harm statement. The other thing that is helpful but not required at this state is we do need to know where they're going. So we'd like to know from the APS worker prior to them admitting, we want to know which nursing home are they going to? That's on the where. That's on bullet 4. We want to know the name of the nursing home, the address of the nursing home, and most importantly, um, a contact. Is it going to be the administrator, social services, something like that? Okay, next slide. Exempted hospital discharge. We're going to spend a little bit of time on this because this has all different kinds of legs to this, and we want to make sure that you understand fully what this is, what the criterion is, and things like that. So, an exempted hospital discharge is for when somebody is going to be in the nursing home for 30 days or less and would otherwise, that's a key word, and would otherwise require a level 2 PASRR because of a diagnosis of mental illness, intellectual disability, or related condition. And so, what this does is it's a way to bypass a lengthy process of submitting the PASSR, ordering the PASSR, getting the results when this person is only going to be there skilled. Now, remember that they must require nursing home services for the condition that they were receiving care for in the hospital. So, for example, if somebody is in the hospital with a diabetic wound and they're needing IV antibiotics, then they would have to be treated at the nursing home for the condition that they were in the hospital for. So they would need their IV fluids. If somebody's in the hospital because, let's say, a fracture, then they would need to receive services in the nursing home to address the reason that they were admitted for that fracture, which would be like PTOT. So, and then let's go back to bullet number 1, and this is really key. The individual to qualify for an exempted hospital discharge, they must be admitted to the nursing home directly from a medical hospital. They cannot, if they discharge to the community first, then they would have to have a level 2 PASSR. They may no longer qualify for the exempted hospital discharge. I had a case, an unfortunate case, just about a week and a half ago. A provider admitted somebody, and this is again, you must receive approval prior to admitting. So Nathan and Steve and I must approve your exemption before they admit. So I had a provider who felt confident, okay, I've got this written discharge from the hospital, so I'm going to admit them first and call later or email that or fax or email that exempted discharge later. So that's what they did. They admitted the individual and then later sent me the 30-day. Well, it was unfortunate because this 30-day exemption was written from the individual's PCP from a clinic, and they had gone home first. So we do not accept an exempted hospital discharge written from a PCP, a case manager. Let me say that the individual must have that discharge sign off can only be an MD or DO from the hospital that they're at. It cannot be a social worker, cannot be a nurse practitioner, and it cannot be their PCP. It must be the attending. So that's a key word. It must be the attending I think I've covered most of that. This is where we get into um, recoupments. And again, we're going to go over recoupments, but this is one of the areas that people unfortunately get recouped on their Medicaid funds is because they did not get that 30-day prior to admission, or they had broken service. That's what we call breaking service when they go to the community um, from a nursing home or a hospital. So just be very sure that you get prior approval and that you get this from the appropriate source, signed off by the appropriate person. Okay, next slide. Okay, so a resident review, they are a follow-up to the pre-admission assessment. Many of you as providers are familiar with somebody having a level 2 PASRR that you obtain prior to admission, and then an annual review will take place. They're, as bullet number 2 states, they're completed annually on clients with a mental illness who are in a nursing home that have had a previous determination, meaning level 2 PASSR, identifying that they need specialized services and identifying any significant changes and things like that. You do not initiate the resident review. They are initiated by OU College of Nursing. So many of you are familiar getting that call from an evaluator saying, hey, this is so and so from OU College of Nursing. It's time for this individual's resident review. Please send medical records. So that's kind of the resident review process. If it's denied, it is, as a nursing home provider, it is your responsibility for making arrangements. So, for example, if a client gets a resident review and it's determined that they no longer at this time meet nursing home level of care because they must go inpatient psych, it is your responsibility to make sure that happens. I do want to say something about that. There are times that you will follow through with that responsibility and you will be denied inpatient. They'll say that they don't meet the criterion for an inpatient psych stay. Number one, we're going to need documentation that they've been denied. And then you will need to let us know because Nathan and Steve and I will talk to you. We'll get with Department of Mental Health and Substance Abuse Services. We have to confer with them, and we will offer other options. Again, what we want is that inpatient psych stay. If they are denied an inpatient psych stay, then there are some other things that we can go about doing, but it requires us contacting Department of Mental Health, and then it is them that decides what needs to happen moving forward if they don't, if you aren't able to get them inpatient psychiatric care. Um, the data from resident reviews and discharges, that's reported to CMS annually, just to let you know. Okay, next slide. Transfers. Okay. So the level 1 screening form, like I said earlier, it must be completed for transfer clients just as it is for new admissions. So this does include transfers from sister facilities. So remember that. Um, we have that reference for more information on new admissions, readmissions, and facility transfers. I can say this about readmissions. If somebody, if you've done a level 1 on somebody and they go to the hospital for a hospital stay, they do not need a new level 1. So that because they haven't discharged, they've discharged to a hospital, but you haven't discharged them to the community. So only a formal discharge from the facility when they leave your facility and go to either the community or another nursing home, only in that case would you do another new level 1. Not if they go inpatient psych, not if they go for a medical stay in a hospital. You do not do a new level 1 for those. Okay, next screen. So now let's talk about some indicators of a major mental illness. So obviously, any diagnosis of a major mental illness. If they're coming from an inpatient psychiatric facility, they may or may not require a level two. It depends on why they were there. If they are having a geriatric psych stay because of behaviors related to dementia, major neurocognitive disorders, or Alzheimer's, unless they also have a coexisting major mental illness, then they would not require a PASR. Most likely, if they're coming from an inpatient psychiatric facility, they would require that level two PASR, which again needs to be completed prior to your admit. Client coming from a residential care facility. So if they've been at a residential care facility, or sometimes people refer to them as group homes, that's an indicator that they would qualify and require a level two PASR. And then if they're on psychotropic medication, let's talk a little bit about that. So yes, it's an indicator, and we want you to take note of that. And that's a good time for a screening with myself, Nathan, or Steve. That's a good time for a call to one of us so we can kind of go through that and um, um, talk about why they're on this medication. What are the milligrams? So let's look at a diagnosis such as, or let's look at a medication being given like Seroquel. Seroquel is often given for insomnia. It's often given in the evening to help somebody with insomnia. It can also be given to somebody because they have a major mental illness. Um, let's look at some of the antipsychotics. Haldol, Zyprexa, um, Remeron. Um, we want to look at why they're being prescribed. So if you call me and say, Karen, I think this person needs a PASR because they're on Haldol, what I'm going to ask you is, or Abilify, we're seeing a lot of people now being put on Abilify who do not have a major mental illness. What I'm going to ask you is do they have a cognitive disorder? Do they have dementia? Or do they need an appetite stimulant, which some psychotropic or antipsychotic medications are being prescribed for. So we want to get down to the root of that. And it's helpful if you have that information before you call us, but know that we're happy to take your call and we may ask you to go find out some information and get back with us. Okay, next slide. Okay, continued indicators. So coming from a state hospital like Griffin Memorial, a family report. If somebody says, you know, mom, growing up, mom or dad was sent to the hospital. Um, we don't really know what it was called, but we know that they were there because they were having mental problems. We know that they were there for a few weeks or a month and then came back home. You want to pay attention to that. And then coming from a nursing home with no diagnosis at all, I know that might seem like a strange bullet, but if you feel like you've not been given from another nursing home or a hospital, if you feel like there's not a lot of information being provided, and perhaps that's because they haven't had them long or this person's from out of state, but again, like the example I gave you earlier of somebody calling to quote screen a patient with the assumption that there was nothing going to be there. And lo and behold, I had a host of information about that individual and that they had, in fact, had PASRs and that those PASRs had actually expired and that they needed a new one. So again, when it says when in doubt, fill out that screening form. Yes, we want you to do that, but also we want you to call us so we can staff that case and work with you to figure out what's going on. Next slide. Okay. So indicators of an intellectual disability or related condition. And Dr. Teet, if you're on the call, In the next few slides, it's going to be about ID and RC. And since that is your area of expertise, feel free to jump in if you want to add something or correct something or update us on something that might have just come about prior to this PowerPoint. So, an individual is considered to have an ID diagnosis if he or she has a level of intellectual disability. It could be mild, moderate, severe, or profound, described in the American Association on Intellectual Disabilities Manual or classification in the intellectual disability, also the ICD, if they have an ICD-10 code. Um, the American Association on Intellectual Disabilities states that an individual IQ score must be 70 with a standard deviation of 5. Okay, next slide. Continued indicators of an intellectual disability. So to be classified as ID, the client must have the following: an IQ of less than 70 that manifests prior to the age of 18. So we're looking at limitations in two or more applicable adaptive skills. So it could be communication, could be self-care, home living, social skills, use of community resources, self-direction, health and safety, functional academics, leisure and work. So these are all the things that we'd be looking at. Next slide. Things to look for with an ID diagnosis. So that diagnosis that we talked about prior to age 18 of ID, special education classes, or perhaps, so we're looking on the special education classes, we're looking at IEPs, 504s, um, or especially also, and I see this kind of in rural areas where they actually were never sent to school at all and were kept at home with mom and dad. If they never worked, married, or had kids, um, or if they did work, but it was, for example, um, a sheltered workshop or Goodwill. I mean, you want to pay attention to where did they work, and was that a subsidized working situation because they have a disability? Obviously, a psychological evaluation indicating a diagnosis of ID, and certainly if they've ever been a resident of an ICF IID home, that would definitely be an indicator. Um, Next slide. Before we get to these related conditions, another thing that I always look for is, have they ever lived independently? That's a big one. Have they ever been living independently, or have they always had to stay at home with family? Okay, so now we're going to go to related conditions. An individual is considered to have a related condition if he or she has a severe chronic disability, a developmental disability, with the following. So it's attributable to a mental or physical impairment or combination thereof of mental and physical impairments. It's manifested before the age of 22. So different than the ID, which is manifesting prior to age 18, this would manifest prior to age 22. And is it likely to continue indefinitely? So is it something that they're not going to recover from in 6 months with some skilled therapy? Results in substantial functional limitations in three or more major life activity areas prior to the age of 22. Next slide. So we're going to talk about some types of related conditions. So these include, but are not limited to, so cerebral palsy, and remember that kind of is on the same spectrum as are a lot of related conditions. When we talked about major depressive disorder, how that's on a spectrum, cerebral palsy is definitely one of those related conditions. We could have somebody with CP that has maybe a minor gait imbalance, or people with cerebral palsy could be in a wheelchair, or they could be total care. So remember, again, the operative word is spectrum and determining of whether they would require a level 2 pass or not. Epilepsy, paraplegia, quadriplegia, a traumatic brain injury or anoxic brain injury, spina bifida, autism, muscular dystrophy, to name a few. Um, any other condition except for mental illness that is found to be closely related to an intellectual disability, resulting in impairment of general intellectual functioning or adaptive behavior. You want to pay close attention to these things detailed in the records received or historical information that might be provided by the family members, caretakers, or legal representatives. Okay, next. So, major life areas would be self-care, ability to care for yourself, receptive and expressive language, learning, mobility, self-direction, and here again is that capacity for independent living, and economic self-sufficiency. Next slide. Okay, now we're going to talk about a significant change. And Jeannie Russell Roberts, my supervisor, is going to talk about this slide. Jeannie?
This is similar and related to the resident review area in that that is one of the reasons that our state does do the resident review annually to capture significant change. So any change in the client's mental condition that may require a review of the level of care and services required to meet those needs, then we would want to do a resident review or a level 2 PASSR at that point. That should trigger that for you. An example would be, the psychiatric inpatient stay was needed. Well, that's a significant change. Medications may change during that, or as Karen was talking about, if an alternative is agreed upon, such as an additional specialized service is coming in, all of those types of things that are significant change, we need to do another level 2, and that is indicated in the rules at significant change to do another level 2. And the most important thing we could say here is, just as Karen has indicated throughout, if you have a question, if you have a concern, go ahead and just give us a call and let us walk through that with you. We're happy to determine if that's a time for another level 2 or not.
Okay, thank you. Okay, so let's go to the next slide. Okay, so again, it's going to trigger an update on the MDS. Obviously, a new diagnosis of a mental illness or intellectual disability or related condition, or improvement or decline in condition. And again, like Jeannie was saying, feel free to call us and we will walk you through that. Next slide. Out of state. So, the Oklahoma Healthcare Authority conducts PASSRs for people within the state. If somebody is out of state and needing to admit to you and they require a level 2 PASSR, will want the state where they're at, even if they're an Oklahoma resident going to an Oklahoma nursing home, will want the state where they're at. If they're at a hospital, somebody's home, that state will need to provide the level 2 PASSR. You can also relocate the client within Oklahoma borders. So if somebody um, is out of state and needs an Oklahoma PASSR, but is able um, medically, and it's safe for them to get to a relative's home or something like that, then you can get them in Oklahoma borders and then order. Again, always consult with us before admission. I know that many of you in those towns close to borders, this is an issue for you. And I know that sometimes we have to kind of go back and forth with Texas and Arkansas. Um, Jeannie is working on having some conversations with some of these border states to see what we can do to collaborate and make that more seamless. That's kind of just new in the works, so that's nothing that's in place now. But just for those of you who your nursing homes are on border towns, just to let you know that we're working on that and trying to make that process, um, you know, uh, as good as possible for everybody involved. Okay. Okay, the time process. So the PASSR evaluations for OU College of Nursing, so that would be the entity that does the PASSRs for people with mental illness. It's about an average of 7 to 9 working days. For for DDS, the turnaround is a little bit quicker or quite a bit quicker. So that's kind of what you can expect. And remember, it's working days. So the results, you're going to get either an email or a verbal, meaning a phone call from either myself, Nathan, or Steve. We will give you the PASSR results. Let me say something right here about that. So oftentimes I hear from nursing homes, and you should do this. If somebody else other than you has ordered the PASSR, and then if they tell you that the PASSR is completed, it is still your responsibility to make sure that that is so. And I've had some people say, oh, I think this hospital is just lying and saying it's done when it's not. Let me tell you what I believe is true. Hopefully not that. And I find that it isn't that typically. What it is when the evaluator does that Zoom call, a lot of people think that that's the end of that. That means the PASSR's done. It is not done until you hear from myself, Nathan, or Steve. And here's why. After the report is, I mean, after the evaluation takes place, the evaluators have to write up a report that has to be submitted for OU College of Nursing. It has to go through Department of Mental Health and Substance Abuse Services. It has to be signed off by a psychiatrist there. So just because the evaluation has taken place does not mean the PASSR is done. Okay. It's not done until Nathan and Steve and I receive an email that that has been completed. And again, we hurry. We know that people are trying to admit and trying to get discharged from hospitals. We give you guys those results. That's the first thing we do is give you guys results. So we try to make that happen as soon as possible. If you disagree with the results, if somebody is denied nursing home level of care, um, then you can request a fair hearing. And we are happy to just call myself, Nathan, or Steve. We'll let you know. We'll send you the documents and walk you through the process. So there is an option again if you disagree with those results. Next slide. All right. So remember that APS initiates emergency PASSRs. Remember that a physician doesn't, a judge doesn't, I don't, you don't, only an APS worker. On holiday weekends or after hours, APS may place the client and they will notify us on the next business day. So I know that we've taught you guys to not accept people prior to that level 2 being done. We don't want you to be nervous about admitting somebody if it's an APS driven referral. We want you to know that's okay. We approve of that. And then what we do is we order the PASR. So they admit the individual to your nursing home, get them in a safe space, get them stabilized, and then once they're there, then the nursing home orders that level two PASR without penalty. I want to make that real clear. It's without penalty if it's APS initiated. Okay, next slide. MDS. So the MDS, again, it's a detailed resident assessment and care screening that is required to be submitted to Oklahoma State Health Department for all nursing facility admissions. The nursing facility is responsible for making sure that if any information regarding mental illness and intellectual disability or related condition is identified when completing the MDS, that a consultation with an analyst, myself, Nathan, or Steve, is indicated to determine if a level two evaluation is required. Okay, next slide. So penalties, let's talk about that. So, a nursing home may receive a penalty for an inappropriate admission. So you admit somebody with a PASR related diagnosis, an intellectual disability related condition, or a major mental illness without consulting with us first. And just to assure you, when you call in and we do these consultations, or if you send a level two in, and it's not warranted, we document that. That's documented in the PASSR system. We don't just say, yeah, it's fine, go on. We make sure that for our records, that's documented, and that for your records, that's documented in our PASSR system. So it's not just a verbal talk. We go to the next step and make sure this is documented, that phone call. So if you do not submit the level two form, um, then that is a penalty. Again, no level two screening done prior to admission. So if you admit them first and then do the level two later, that's a penalty. Client does not fall under provisional admission. So it's a case where they don't fall under that delirium, coma, UTI. That's another that I should have mentioned. A UTI is another case where somebody might have a provisional admission. Or if somebody had had a level two screening, but that level two had lapsed. And this is a good time for me to say that regarding PASRs, PASRs lapse either because for mental illness because of one of three reasons. Number one, they have not been updated annually because maybe they have gone somewhere else or their PASR is not current. Or if they've had in some cases, and Nathan and Steve and I can tell you which kind of, I'm not going to go into the acronyms and all that because it's nothing you need to remember, but just know that we kind of have two PASR categories for people with mental illness. One is for people who need that annual review because they need to be followed more closely. Those PASRs are good for a year. And then area, which another kind of PASR where somebody, their PASR is good indefinitely with this exception, unless they go inpatient psych 2 times. They may go 1 time, but if they go that second time, they must have a level two PASR completed before they return to you. And it is your responsibility. It is the nursing home's responsibility to keep up with that. That's nothing that Nathan and Steve and I or the healthcare authority keep up on. That is your responsibility. So that's your responsibility to document when you send them outpatient, inpatient psych, so that you'll know, have they been no times, 1 time? Is this their second time? So that's something that you'll want to make sure that's documented clearly. Um, or if they break service. Now, somebody with the kind of PASR that is good indefinitely, unless they've been inpatient psych twice, they can actually break service, meaning go in and out of the community, switch nursing homes, things like that. Somebody who requires that annual review, if they quote break service, not to go to a hospital, but to go to the community, then that PASR is void. Then they need a new one before you readmit them. And remember that if you want to know anything about this, like, just give us a call and say, is this PASR current or do we need to order a new one? Do this all before you admit them, please. Okay, next screen. These are the references. Um, this is our contact information. Um, okay, so these are our references. Um, and you can find all our policies listed here. Next screen. We'll
Looks
go
like
to the analysts page where you can see our contact information. There we go. So these are our three analysts. That's our fax and our email. And remember, 30-day exemptions go straight to the individual analysts. Level 2 PASRs do not go to the individual analysts. They go to that 708 7181 number, which is on the top of the level 2 PASR form that you submit.